The following is a paid commercial message from Bold One Laboratories, the makers of acetol. This infomercial is designed to help you make informed and educated choices regarding your prescription medicine. Recent research has determined that people who suffer from consistent and constant gassiness are 3 times more likely to be embarrassed in public, and are not only harming the atmosphere and the environment, but they're also putting loved ones, relatives, and friends at risk by repeated exposure to harmful and toxic butt gas. That's why Bold One Laboratories developed acetol, the once daily gas reduction medicine designed to take the stink out of daily living. Acetol works by removing the enzymes from digested food that create trapped gas. And in recent studies, 9 out of 10 patients who used acetol on a regular basis say they now poop half as much. But acetol may not be safe for everyone. Only you and your doctor can determine if acetol is right for you. Common side effects include an increase in homosexuality, blatant hostility toward animals, unexpected bowel movements, anger, depression, dysplasia, suicidal thoughts, and tendencies of uncontrollable anxiety, followed by still more anxiety, loss of appetite, speeding, wild driving, and loose morals. You should not take acetol if you walk, jog, or ride a bike. People who bake pies or write on chalkboards, use deodorant, detergent, red dye number 3, 7, or 8, or watch more than 2 hours of TV a month should avoid acetol without consulting a qualified medical doctor, and not necessarily your friend who used to be a nurse. People who use acetol for more than 3 months may even develop the runs, rash, rectal bleeding, and enlarged butt cheeks, tendinitis, tennis elbow, 10 little Indians, tetanus, typhoid fever, and become cross-eyed. Do not use acetol if your tongue, ears, or nose swell, if you have shortness of breath, bad breath, loss of breath, trouble breathing, sleeping, eating, or speaking in tongues. Other side effects include constipation, clubfoot, lockjaw, web feet, nasal infection, leprosy, bleeding of the esophagus, uterus, or spleen. Women who have been pregnant or may become pregnant should avoid hitting a crack pipe or taking multiple shots of tequila when using acetol. If you or someone you know is pregnant, if you're considering pregnancy or even thinking about the possibility of pregnancy, or if you have a history of pregnancy in your family, you should only take acetol if there are no signs of severe psychosis present when starting this medication. As with all medications, you should carefully read what the American Medical Association has to say about untested medicines, or medicines that are manufactured in shabby third world countries such as Bangladesh, Bulgaria, Somalia, Burma, Botswana, the Lesser Antilles, and Poland. In rare cases, acetol has resulted in permanent brain damage, fallen arches, prolonged sneezing and hiccups, fainting, clinical depression, paralysis, blindness, deafness, infertility, sterility, immobility, confusion, concussions, contusions, with an occasional death here or there. If you can't afford acetol, you can consider refinancing your home or applying for medical assistance through a local charity or government agency, because Bold One doesn't give handouts and there's no free subsidies. Your health and your happiness are important to you and your family, but remember, be cautious when taking drugs, because it's better to have no acetol than to put your health at risk. The 7-page disclaimer printed on every small bottle and every box of acetol should be read, and we even offer free reading glasses with a mail-in rebate to help you with that. If you're willing to risk all these possible consequences, ask your doctor to recommend twice daily or once daily acetol for you today, and take the stink out of daily living. Poot less with acetol. Acetol is a non-narcotic, non-habit-forming, non-effective mixture of carbocarbophenodendarine and sulfodium boxtite inebriol, and should be kept out of the reach of children or comatose bed patients and older people who are just barely alive anyway. Acetol, once daily or twice daily for a cleaner, fresher, more tolerable you. Poot less with doctor-recommended acetol. It might kill you, and it might not.